The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. Every week I will discuss health-related issues that pertain to our community. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. If you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York. Or give us a call, 631-980-8200. That's 631-980-8200. Well, to my military family, I got your six. To my Masonic brothers, the light is bright. All right, before we get into today's topic, which is diabetes, there's 2 points I'd like to cover. The first is, I wanted you to understand what my role is. I am a primary care physician. I'm a family physician, a primary care physician. It's also known as a PCP. So if you're looking for a PCP, come to me. I would love to care and make you happy and healthy. This is what the function of a PCP is. So what do I do as a PCP or a family practitioner? First is, we're going to do a thorough history and physical as I described 2 shows ago. Then we will determine if you have needs. My mission is to make sure that we screen out for diseases. If there is a disease, we work together and come up with a plan and implement it. The goal here is to, 1, catch it early in the early phases, and we're going to try to reverse it. If we're not able to reverse it, I want to slow the progression down. That is the function of a PCP. The second is, a lot of patients are not able to, because this is one of the number one complaint of patients in our community. I cannot get into my doctor. The average is 6 weeks. Well, with me, I have an affordable concierge service. You're not going to wait 6 weeks. I will be able to get you in within the same day or the following day when you need to be seen. Using urgent care centers, they're for acute care. They're not designed for chronic care. We need what we call continuous care or continuity care, and that's what a PCP does. I provide continuous care. You're seeing the same physician from start to finish. You're not going to get that with urgent care centers. They have different providers every time you go in, and then the providers are not physicians. Sometimes you'll have a physician, but you're going to have PAs and nurse practitioners. I am a physician, a family physician. All right, so now on to diabetes. What is diabetes? Diabetes is a metabolic disorder in which blood sugar levels are elevated. Wow, what's that? What does that mean? In simple terms, uncontrolled blood sugar levels. That's it. But that's pretty significant. There are 2 types of diabetes, and I will focus on type 1 and type 2 for this particular show. Type 1 diabetes is known as juvenile diabetes, or what we call insulin dependent. Typically, the onset of type 1 diabetes is during adolescence. A child develops some symptoms, speaks to the parents. The parent says, "What's wrong? I'm not feeling well." The parent brings the child to the doctor, and they discover that the child has diabetes. Turns out it's type 1 diabetes. So the doctor puts the child on medication, and then the blood sugars start to drop. Well, there's a working theory of why this happens. The child developed a viral infection like Epstein-Barr virus or cytomegalovirus, and that virus attacks cells in the pancreas, and they're called the beta cells. Those beta cells, the function is to produce insulin. After the infection, those cells are damaged. They either produce very little or no insulin at all. So what do? How do we treat that? We use exogenous insulin to bring down, meaning insulin outside. You have to take it, draw it up from a bottle, or you can use what we call a flex pen. And then we deliver it and, inject it into the body, and that will help lower the blood sugar levels. Type 2 diabetes, this is what we call insulin-resistant diabetes. And this is directly related to your weight gain, obesity. The more weight you gain, there's an increased risk for developing type 2 diabetes. So the theory behind type 2 diabetes is that the more weight you gain, there's an increased gap between the receptors at the cellular level. Well, I don't want to get too fancy because it's not. I don't want to be technical, but it's called the spatial theory. And I'm going to give you an example so you understand this concept. So you and I were playing ball, and I'm throwing the ball back and forth. You have a glove, we have a glove, and I keep throwing it back and forth. Now, the ball is the insulin, and the glove is the receptor on the cell that catches the insulin, catches the ball. Now, as we get further and further apart, there's an increased risk for that person to drop the ball, or you to drop the ball, or I will drop the ball, meaning that the further apart those receptors become, there's a good chance that the insulin receptor is not going to bind with the insulin. That's it. Now, how does the insulin, what's the function of the insulin, and how does the insulin work? Let's keep this really simple. Think of a lock and key. So you have a lock on a door, and then you have the key. The key goes into the lock, you turn the lock opens, the lock opens, then we can open the door, and we're able to enter the room or exit the room. Well, that'd be the same thing with the insulin. The insulin binds with the receptor, and then it opens up the cell, and we're able to drive sugar into the cell. So that would be what we'll call the lock and key theory. So let's get into some questions here. Very important. I want you to understand that if you have questions, you can reach out to me. If you go to my website, there's a tab that you can drop down. You click, and then it'll say Contact Dr. O'Brien, and then you can type in a question. I've had several individuals send me an email, and now I'm starting to answer those emails. As you know, if we had an answer questions section, that's why we're doing this. So if you have a particular question, send me a note, and I'll try to address it on air. So the first question is, how many people have diabetes? According to the CDC, approximately 37 million Americans have diabetes. That's about 11% of the population. That's pretty significant. What are the signs and symptoms of diabetes? There are several signs and symptoms, but the main symptoms are increase in thirst and urination, weight loss, as well as blurred vision. Some people get a little bit irritable, but these we can address these. This is, again, something very important. I always keep saying again. The last show I said again and again, and I'm going to explain why I say again, because I want you to focus on it. And I was an athlete growing up, and my father was my coach. And to learn a move, it was repetitive. And my father kept saying again, again, again. And I had to keep repeating that move over and over and over, so it became second nature. So I'm going to keep saying again, so this knowledge becomes second nature. I need you to be proactive and be in charge. Come to me and let me help you care for your healthcare needs. So again, make that call. Very, very important. To learn more about my practice, go to drtomio.com. That's drtomio.com. If you prefer to stop by my office, it's located at 250 Patchogue Gap Road, Suite 16, East Patchogue, New York. Or give us a call at 631-980-8200. 631-980-8200. I provide an affordable concierge practice, very affordable, so you and I can focus on your needs. So we can spend time, quality time that you deserve, that you need, so I can sit down and educate you, so we can go through each issue, no rush, me caring for you and you getting the results you deserve. So I want you to memorize this saying. If you wait, it's too late. So if you're waiting for symptoms, it's too late. Come and see me. Let's do a history and physical. Let's screening, blood tests, the exam. If I find something, we'll discuss it and we'll address it. We'll try to shut it down, or we can slow the progression of the condition. Give us a call. If you wait, it's too late. We're going to go into break. When we return, I'll answer more questions. Welcome back to the Dr. Tommy O Show. Today's topic is about diabetes. And in the first half, I discussed, we defined it, and we started going into questions and answers. Before we continue, I'd like to go over, I know what you're thinking. Why should I sign up now? I want you to be proactive and take control of your health. So come on in and join my practice. Let me help you lead a happy and healthier life. If you wait, it's too late. I want you to memorize that. Learn it and live it. If it's late, it's too late. If it's late, it's too late. Back to the questions. What is considered normal blood sugar levels? Normal blood sugar levels range from 60 to 110. I know the reference ranges are changing. They want to reduce it from 70 to 100. That's not correct. That's not how it was taught. 60 to 110. Is a one-time blood sugar reading greater of 110 considered diabetes? Absolutely not. It all depends on what you were doing before we did the finger stick. So there's two ways that you can check for sugar. The first is a finger stick. Okay, and that tells you what your blood sugar reading is right there, right now when they take the finger stick. If it's elevated, is that diabetes? Not necessarily, because if you just had a sweet drink, or you just, something sweet, maybe 30 minutes before, your blood sugar is going to be elevated. We use what's called a glucose tolerance test, and that's when women, when they're pregnant, we want to see if they're developing gestational diabetes. So we do a 3-hour glucose tolerance test, and so the first hour will be positive. In order to have a positive glucose tolerance test, you will have 2 out of the 3, and by definition, you'll have gestational diabetes. So that is not diagnostic of diabetes. So what do? We define diabetes as uncontrollable blood sugar levels that are greater than 110, and it must be over a 3-month period. The unit of measure is called hemoglobin A1C. The hemoglobin A1C measures the blood sugar levels over a 3-month period. It's a window. So what we do is we draw blood work and we send the lab out and we order a hemoglobin A1C. Now, the A1C is much more accurate determining if the patient has diabetes than a finger stick. So the hemoglobin A1C is a unit of measure, and let's describe what that unit of measure is. As I stated, the A1C, the hemoglobin A1C, measures the blood sugar levels over a 3-month period of time. An A1C reading of less than 5.8 is considered normal. So I'm going to give you a range. So there's a sliding scale. So if you have a hemoglobin A1C of 5.8 or less, you do not have diabetes. If you have a hemoglobin A1C reading of 5.9 to 6.4, you have what's considered pre-diabetes. And that is a signal, and that's telling us as a primary care physician that you need to pay attention, because if this continues, you're going to work your way into diabetes. So if your hemoglobin A1C is 6.5 and greater, you have diabetes. Now I'm going to give you a story here. I was practicing in the South Bronx. That's where I trained. I practiced there for 16 years. I would see individuals that would have hemoglobin A1Cs of 18, 19, 20. The highest I've ever seen was 22. And what is that telling me? That tells me that blood sugar is 500 plus, that it averages over 500. And that is why the Bronx is the unhealthiest borough in all of New York City. It's number one for diabetes, number one for HIV, number one for obesity, and it's up there for cholesterol because it's all related, minus the HIV, but the diabetes, the hypertension, the obesity, all related. So my goal was to drive, our goal as physicians is to drive that A1C is as low as possible where the patient can what the patient can tolerate. Of course, you don't want to go too low because then you have hypoglycemia, but the goal here is to drive them as low as possible. Just recently, I had a patient come into my office. I had some issues. It's a 90-year-old, and this individual was brought in with their caregiver and said that they had a blood sugar of 465 and placed on medication, but the person just didn't feel comfortable with the medication. So what I did was I educated the patient and the caregiver on how to take the medication, and I said, let me place you on medication that's been around for 40 years, and it works very, very well. And I said, what I can do is, this is how you're going to take it. We're going to start slow because of the age, so I want to start low, go slow. That's what we say in medicine, start low, go slow. And I'd like you to follow up me in 4 days. Over this 4-day period, let's do a diary. I want you to take your blood sugar twice a day and then write that down so I know if the medicines, the two medications are working. They came back 4 days later. The blood sugar is now 250. So it went from 465 down to 250. So what I did was I explained, let's keep the medication exactly the same, and I want you to come back in 2 weeks, and then we'll make a decision if I need to advance the medication. Let's continue with diet modification, a little behavioral modification. So now I'm waiting for the follow-up. How do we treat diabetes? This depends on the type of diabetes. Type 1 insulin-dependent diabetes, of course, it's always diet modification, behavioral modification, an exercise program, and we're going to use exogenous insulin. Unfortunately, like I said, beta cells, they're not functioning, so we need to take insulin from outside the body and inject in. There's all different types. You have short-acting, and typically we give those with meals, and then we have a very long-acting insulin that we give once a day, typically at nighttime. Works extremely well. You have to be compliant. If you want, this is in life in general, if you want good response to health, you have to be compliant. If you're not compliant, you're not going to get the outcome that we expect. So for type 2 diabetes, again, this is based on your weight gain. Well, we want to reduce the weight. Diet modification, behavioral modification, and an exercise program. But before you take an exercise program, and make those changes, you must be cleared. Now, if you're my patient, I'm going to clear you. We're going to start on an exercise and diet plan. It depends on how high that blood sugar is. I could start off with just conservatively with just a diet and exercise. If it's beyond what I feel comfortable with, then I'm going to start you on medications, and this would be oral medications. And I'm going to have you come back, follow up in a week or two. We're going to check that blood sugar and see what we need to do and if we have to advance. The patient has to be proactive. You have to be a part of this. In medicine, you have to be part of the program. It's not just the physician. If you want a good outcome, I always say, the reason why I'm successful is because the patient is compliant. The more compliant you are, the better the outcome, and you make me look better. How do we make our patient compliant? You have to educate your patient. The patient has to understand what their condition is, why it happened, how the medications work, and what to expect. If they walk away with knowledge, if you walk away, again, if it's, if you wait, it's too late. I'm trying to prevent or at least slow down the progression of disease. So if you're compliant, you follow medical instructions, there's a greater chance that there's going to be a better outcome. So if you want to learn more about my practice, Let's go to www.drtomio.com. That's drtomio.com. If you prefer to stop by my office, that's 250 Patriarch Yaphank Road, Suite 16, East Patriarch, New York, or give us a call at 631-980-8200. I provide an affordable concierge practice that is, I want you to understand that how much you pay for gym membership, my fee is going to be less than a gym membership, and you get to see me as many times as you want a month. I'm here to help you make better decisions to lead a happier and healthy life. Let me help you improve yourself. I love this. This is what I've done. I started medical school 32 years ago. I'm here for you to serve the community. Again, you wait, it's too late. Make that call. I'm taking patients now. Call my number. Go to my website. Learn about me. Learn what I do with the community. And let me help you lead a happier and healthier life. Thank you. My name is Dr. Thomas O'Brien, host of Dr. Tommy O. God bless.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.